Are you a registered nurse that's planning on coming to the United States and are wondering what major challenges do foreign nurses face in the United States? So in today's video, I will break it down for you. So make sure you watch this video till the end because I'm also going to tell you how we can overcome those challenges. So without wasting any time, let's dive right in. Hello everyone, my name is Karen. I've been a nurse in the United States for about 6 years now, and on this channel, I'm helping registered nurses get through their NCLEX-RN journey with flying colors. So let's get back to the topic. Did you know that thousands of foreign trained nurses come to the United States to work every year? They play a crucial role in the healthcare system of the United States. But many of the nurses, including myself, face major challenges when they come to US. But most people never even think about that. The number one factor that we're going to talk about today is language barrier. Sure, many international nurses speak very good English, and also English is the major component in order to pass your NCLEX or an exam. I always advise my students the main thing to passing NCLEX or an exam is to understand the question, and in order to understand the question, you have to have a good understanding of English. But let me tell you, American English is a different beast. There's slangs, acronyms, and fast talking patients in the United States. People use a lot of jargons here. People use a lot of slang here, and different people from different areas have different way of speaking. Although I've been here in the United States for so many years, I still struggle to keep up with every kind of patient that I see all the time. It is so hard to understand what somebody's trying to tell you because so many people have different ways of saying things. A lot of the states in the United States have totally different accents. Like the state that I'm in, California, we speak very normal English, but then some areas the people speak English very, very fast, and it is very hard to understand those people. So, this is going to be a major challenge when you come to the United States. The second factor that we're going to talk about is workplace culture. In many countries, healthcare has a strict hierarchy. Whatever the doctor tells you, that is final, and you have no rights to question the doctor. I'm from Pakistan, and I kind of feel it was the same way over there too. Not just with nurses, but also with patients. I have myself seen doctors getting upset just if they are asked questions by a patient. In the United States, it's not like that. The whole healthcare system works as an interdisciplinary team. Everybody gets on the same page and then decisions are made. As a nurse, you can always question a doctor for something that you cannot understand. And not necessarily you don't understand, but even for your knowledge, if you ever ask a doctor a question, they are always more than happy to teach you. You, as a nurse, have all the rights to speak up and advocate for your patients. Now, at some point, you might feel uncomfortable by this, but let me tell you, this is a perfect example of how teams should function. And you might be uncomfortable at first, but with time, you are going to get there for sure. And once you're there, you will also get comfortable with asking questions. The third factor is patients' expectations. American patients often ask for eye contact, empathy, and being part of their decisions. But in some cultures, making direct eye contact with your patients is considered disrespectful. In the United States, if you do not make eye contact with someone, they have a hard time trusting you. So you gotta keep in mind that you have to look in people's eyes when you're talking to them. I have a coworker that told me where she was from, when the doctor talks, the patients only listen without saying a word. So when her US patients asked a lot of questions to the doctor, this nurse thought that this patient was difficult. And this is a very common scenario. People here know a lot about their diagnosis even before they come to the doctor. So you have to have all the knowledge to answer the questions that your patient might have. Number 4 on our list is emotional challenges. Now, the country where I'm from, I was very social. I would hang out with my friends all the time. Even at work, we would hang out. We had so many friends that we would go to coffee shops together, hang out at different places. But when you come to the United States, a lot of the people here are very, very busy. The only time you get to hang out with your friends or your family is over the weekend, and it's still not like other countries that you can call them and see them anytime you want. You have to make sure that the person that you're going to is available just for you and does not have any other reservation. And this does not go for your friends. Even with families, it's like that, which was a big cultural shock for myself. Also, I was lucky to come here with my family. Many nurses don't have their family, they come here by themselves, and it gets really hard to adjust to this new culture and they start feeling isolated. Coming to United States is just not about adjusting. It is about adjusting to a whole new world. Now let's talk about how foreign nurses can overcome these challenges. Number one would be language improvement. Now what you can do is go watch movies, go watch a lot of Netflix shows, try to talk to your friends in English. Just try to get better with normal conversation. Once you get better with normal conversation and you come here, when you conversate with people all the time, you start adapting to new words, you start adapting to new habits, and that is what's going to make a difference for you. But language is very important if you come to United States as a registered nurse. Number 2 is cultural training. There are many YouTube channels that are going to teach you about United States. I would highly recommend, instead of watching other things, if you're a nurse that wants to come to US, go watch these channels. Go and see how people live in the United States, how people interact, what are the things that you need to be careful about, what are the things that are considered very sensitive here. Once you know all these things, you're gonna have a very smooth start when you come to United States. Number 3 on my list is mentorship program. Now when I was new here at my first job, I paired up with a foreign nurse. Now, this nurse taught me a lot about the hospital itself, about the culture here. So, there are many, many good nurses that you can choose from when you come here. Once you come to US as a foreign nurse, it's not that you just get thrown on the floor. They make sure that you give you a proper orientation. In this orientation, make sure you ask your mentor as many questions as you want to get familiar with your surroundings. And over here, nobody's gonna think you're stupid if you ask a question. Everybody is always ready to answer you. That's at least what my understanding or my interactions have been, and I'm pretty sure it's gonna be the same for you. So never ever hesitate to ask questions. Number 4 on my list is networking. Now, once again, there are so many pages on Facebook that you can join and start interacting with like minded people, with like minded nurses. Just text them, just ask questions. Networking is going to make a huge difference. Not just that, you can also join some pages where there's just foreign nurses. Now, foreign nurses who has actually went through the process would know way better than somebody who's been here their whole life. So networking is a key. Just get on Facebook, just go join some groups and start reaching out to people to know more about how the system works. If you have any questions, I'll always be more than happy to engage with you as well. You can always contact us on our Facebook or Instagram page, and I'll be more than happy to answer you and answer your questions. So, in conclusion, foreign nurses play a vital role in the healthcare system of United States. However, cultural challenges can make their journey a little stressful and give them a hard time to start off. But these challenges are not the end of the world. There are a million ways to overcome these challenges, so don't let anything stop you from reaching your goal of being a nurse in the United States. I hope you liked this video, and if you have any questions, leave a comment down below, and don't forget to subscribe to our channel for more videos like this. Thank you for watching this video, and I will see you in the next one.